broad term that refers to compression of the neurovascular structures in the area above the first rib behind the clavicle. Also, you could add into there, because we talked before about it, can start anywhere from a cervical rib to the scalene triangle to the area under the clavicle, between the clavicle and the first rib, and then also under the coracoid process. And what's the muscle that attaches to the coracoid process? Pec minor, right. So that's the one where you can have more of the symptoms when you're raising the arm up like this. And most of the time, the structure that's compressed is the brachial plexus. That's going to be about 95% of the time. So that's where you're going to get the neurologic type symptoms. Sometimes you'll get the subclavian vein and subclavian artery. And we talked about last time, what are the types of symptoms that are unique to the vascular part? What kind of symptoms do you get with vascular conditions that you don't get with others? Right. When it goes, if it's going to the head, it's going to be nausea and dizziness. And what else?
Discoloration.
Yeah, discoloration. Either it can be blue or white. And temperature. Right. So it'll be cold. So then, like in the notes, there's different parts. As you start from the spinal cord and moving laterally, the different structures that can compress it, like I mentioned, is one, the cervical rib, then the scalenes, then the subclavicular space, and then the pec minor. So then cervical rib, you can see that, I don't know if you'll be able to see that, but it's coming off of C7. Obviously the first rib is supposed to come off of T1, but in some cases you can have either, it can be a bone, or it can be a rudimentary thing like just cartilage. Maybe it didn't ossify, so you just have some cartilage or a fibrous band that's going across and it's going to constrict them. And then you have scalene Anticus syndrome. Basically, it's going to compress the brachial plexus and or the subclavian artery as they pass in the triangle between the scalenes. So then here's the triangle right here. So you can see it has the artery and the brachial plexus. If you remember before we talked about the vein doesn't enter into the picture yet. It starts here where you come under the clavicle. So it can be caused by hypertrophy of the scalenes or a widened insertion. Things that can contribute to that can be scoliosis or poor posture. And then since the scalenes are an accessory muscle of respiration, if somebody has maybe a breathing problem and they're using their scalenes a lot, because you can palpate the scalenes if you feel on the side of your neck right here, and then you try to take a sudden deep breath like that, you strain to breathe, you'll feel the muscles pop up, right? And there. So because they attach into the first and second rib, so they're helping with breathing to raise that up. And then if there's some type of injury to the scalene muscles, they can heal with fibrosis. That can affect it. Yeah, I think those started over there, so maybe just say the other thing, and I don't know if it's in here, is that the scalene muscles attached to the neck vertebrae, right? So turning the head is going to affect the scalenes. So when we get into the special tests that involve movement of the head are going to be affecting the scalenes. Now we're talking about hyperabduction, and again, that's that coracoid process and the pec minor, so you have the structures that come underneath there. And then again, that's going to be symptoms where people will say when they're working with their hands overhead, they start getting the symptoms into the hands. And then okay, and then here you have costoclavicular. Okay, so that's costoclavicular by the name of that. That is talking about the clavicle and the first rib. So that's going to be symptoms where they're going to be carrying a heavy bag or something heavy on the shoulders, a heavy backpack, or carrying bags of groceries or something like that. And then that's going to narrow the space between the first rib and the clavicle. And then when we're talking about symptoms, you're going to have, they're going to complain of carrying something heavy, or depending on what structures are involved, it could be when they're putting their arms up overhead. And most of the time it's going to be in the C8 and T1 dermatomes. So what part of the extremity is that? Do you remember? This area here. C8, T1. Okay. And a lot of times it's going to start in the fingers and it's going to work its way up. And then you can have a dysfunction in the motor problems, so they maybe have discoordination, or they say there's weakness, they can't grip things. You're going to say it feels like their hand goes to sleep. It's a dull ache. Sometimes also it can start in the neck and back, also manifest down into the shoulders and then the medial side of the upper extremity. All right, if the artery is affected, you're going to have coldness, paleness, and weakness of the hand or tiredness of the hand. And then with venous obstruction, so the artery is what gets the blood to the extremity. So if you're not getting blood to the extremity, you're going to have the discoloration, cold. Venous is what brings the fluids away from that area, brings the blood away from that area. So if you block the veins, what's going to happen? It's going to swell up. And then obviously if it's the brachial plexus, you're going to get the symptoms of the tingling, numbness, things like that. And I don't have this chart in the notes, but it's in the book. So this just goes into what types of things are the differences between Facet syndromes, nerve roots, thoracic outlet. Now, out between those three, which are the ones that are going to be more likely to have symptoms down into the upper extremity? The facet, the nerve root, or thoracic outlet? Yeah, nerve root and thoracic outlet. Facet's usually going to be localized just to one side of the neck. Okay, so then you can review this in the book, but basically the specific things about thoracic outlet, if the artery and vein are affected, you're going to have the coldness, discoloration, redness, white, paleness, things like that.